Doctors run tests, scans, blood work, but one of the easiest health checks is right in front of you. Your tongue. Almost nobody talks about this, yet it can reveal hidden deficiencies, circulation problems, and even early signs of cancer. But the problem is, very few people actually know how to read these signs. So today, I'll show you exactly what your tongue's color, texture, and shape can reveal, from small vitamin deficiencies to serious conditions you should never ignore. Your tongue isn't just for talking, tasting, or helping you chew. It's a surprisingly powerful diagnostic tool. In fact, in traditional Chinese medicine, doctors have examined the tongue for over 2000 years to spot imbalances in the body. And modern research backs this up. Studies show that certain tongue changes can be early warning signs of systemic diseases, nutritional deficiencies, or infections, often before any symptoms appear. Just think about that. A quick look in the mirror could give you clues about your heart, your blood, your liver, your immune system, even your thyroid. But before we go into the warning signs, we first need to know what a healthy tongue actually looks like, so you'll instantly know when something's off. So, a healthy tongue is actually a light pink color, not too pale, not too red, with a slightly rough, velvety surface from thousands of tiny bumps called papillae. It should be moist, flexible, and free of cracks, ulcers, or thick coatings. In dental exams, we look for the symmetry too. The top, the sides, and the underside should generally match. And here's something most people don't realize. Your tongue is one of the most vascular, meaning blood-rich muscles in your body. That rich blood supply is what gives it its healthy color. And because it's constantly soaked in saliva, changes in hydration or circulation can show up here faster than almost anywhere else. If your tongue looks like this healthy baseline, it's a good sign your circulation, hydration, and nutrition are on point. But if it doesn't, the next signs could tell you exactly what's going wrong, and in some cases, give you an early warning before blood tests or scans ever would. Now, imagine looking in the mirror and you notice your tongue doesn't have that healthy pink glow anymore. Instead, it's pale, almost washed out. Why? Your tongue is packed with tiny blood vessels, and when your red blood cell count drops from low iron, vitamin B12, or folate, there's less hemoglobin to carry oxygen, and that means less color. In one large study, nearly 1/3 of the global population was found to be anemic, and many didn't even know it. For some, the very first clue wasn't tiredness, it was their tongue. And it makes sense. Your tongue is like a live oxygen meter you can check every day without any equipment. So ask yourself, have you been unusually tired or dizzy when standing up? If yes, your tongue might be warning you of anemia. Now, this one catches people off guard, because a bright red tongue can look kind of healthy at first glance. But here's the twist. If that bright red surface is also unusually smooth, almost glossy, like it's been polished, it's often a red flag for nutritional deficiencies, and specifically vitamin B12, folate, or iron. Think of your tongue's surface like a lush lawn. Those tiny papillae, the bumps that gives it texture, are the grass. When your nutrition dips, that grass starts to thin and bald patches appear, leaving the surface shiny and exposed. But this isn't just about appearance. In one study, up to 40% of B12 deficiency cases were missed at first because the symptoms were vague. Things like fatigue, mood changes, or a burning sensation on the tongue. And here's the kicker. If B12 deficiency goes on for long enough, it can cause permanent nerve damage. So the next time you see that red, glossy surface in the mirror, you might be deficient in vitamin B12. Now this is one of the most dramatic looking tongue changes you'll ever see, and it's also one of the most misunderstood. If you look in a mirror, stick out your tongue, and instead of a smooth, even surface, you see strange shapes and patches, almost like continents on a map. Some areas are smooth and red, others have a slightly raised border. And here's the really weird part. The pattern can change overnight. One day it's here, and the next day it's shifted somewhere else. This is called geographic tongue, and despite its shocking appearance, it's usually harmless. It's not contagious, and in most cases, it doesn't point to a dangerous disease. And here's where people get caught. It can cause discomfort. Many patients report a burning or stinging sensation when eating acidic or spicy foods. We don't know the exact cause, but research has linked it to immune system activity, stress, allergies, and even genetics. One large review found that up to 3% of population may have it at some point in their lives, though most never even know the name for it. So if you see this, don't panic, but do pay attention. While it's usually benign, persistent or painful cases are worth showing to a professional just to rule out anything else. Now this one is a little more subtle, but once you've seen it, you'll never unsee it. Look closely at the sides of your tongue in the mirror. Do they have little waves or ripples along the edges, almost like the creamed edge of a pie crust? If so, you might have what's called a scalloped tongue or a crenated tongue. And here's what's happening. Your tongue is a muscle, and just like any muscle, it can swell. When it gets just a bit too big for your mouth, it presses up against your teeth, leaving those characteristic grooves. And that swelling isn't random. It's often a clue. And one possible cause is chronic teeth clenching or grinding, something many people do without realizing, especially at night. And another, sleep apnea, where the airway is partially blocked during sleep, often linked to a thicker or swollen tongue. And here's one more you can't afford to miss: low thyroid function or hypothyroidism. When the thyroid slows down, it can cause fluid retention throughout the body, including the tongue. That's why in some hypothyroid patients, the tongue looks puffier and the edges get scalloped. One study even found that nearly 50% of people with hypothyroidism showed scalloped tongue patterns. That's not a coincidence. So if your tongue has these ripples and you've been feeling unusually tired, gaining weight without explanation, losing hair, or feeling cold when others don't, this isn't just about your tongue anymore. It's about getting your thyroid checked and taking action before it impacts the rest of your health. If you've ever stuck out your tongue and seen a thin, even layer of white, don't panic just yet. A light coating is normal. It's made of microscopic dead cells, harmless bacteria, and tiny food particles. But here's where it gets interesting. If that coating becomes thick, uneven, or patchy, it can be a sign your body is trying to tell you something. One of the most common culprits is oral thrush, a yeast overgrowth caused by a fungus called Candida albicans. Normally, your body keeps this fungus in check, but when your immune system is weakened, say after a course of antibiotics, using steroid inhalers without rinsing, or in people with diabetes, it can take over. Thrush often looks like cottage cheese stuck to your tongue and can feel sore or cause burning sensation. And here's a stat you might not expect. The CDC estimates oral thrush affects up to 5 to 7% of newborns and is also common in older adults with dentures. It's more widespread than most people think. But there's another white patch you can't ignore: leukoplakia. This is a thickened, white area on the tongue that does not scrape off. While most cases are benign, some can become precancerous. In fact, studies show that as many as 17% of leukoplakia cases may show early cancerous changes under the microscope. The takeaway: if you see a white coating that's new, worsening, or don't go away in 2 weeks, it's worth getting a professional opinion, because this is one of those times where early detection makes all the difference. This one sounds a bit scary: black hairy tongue. But before you panic, let me reassure you, it's usually harmless. The name comes from the way tiny projections on your tongue, called papillae, start growing longer instead of shedding normally. Think of them like little carpet fibers. When they get too long, they trap bacteria, food particles, and pigments from coffee, tea, or tobacco, turning them brown, yellow, or jet black. And here's the thing most people don't know: the hair isn't actually hair at all. It's just overgrown tongue tissue. It can look shocking enough that some people rush to the ER thinking something is seriously wrong. Up to 13% of people in certain populations may develop this at some point, often linked to poor oral hygiene, smoking, or certain antibiotics. The fix is simpler than you think. Brush or scrape your tongue daily, stay hydrated, and cut back on staining foods and drinks and tobacco. Within a week or 2, your black carpet tongue is gone. But there's something more. While a black hairy tongue itself is usually harmless, if it appears suddenly or with other symptoms like pain, swelling, or a foul odor that doesn't improve, that's when you get it checked, because it could point to an underlying problem. Now this next one sounds fancy: caviar tongue. but it has nothing to do with expensive seafood. If you lift your tongue and see dark, bulging, grape-like veins underneath, you might think something's gone terribly wrong, but in most cases, it's perfectly harmless. These enlarged veins, also called as sublingual varices, happen as we age. Kind of like varicose veins in the legs, but in this case, just under your tongue. They're present in over 60% of people over the age of 60, simply because the vein walls lose elasticity over time. And they can look dramatic, purple, blue, almost like fish eggs. And that's how the name caviar tongue stuck. Most of the time, they cause no pain and no need for treatment. But if you notice they're suddenly appearing at a younger age, or one area looks larger, harder, or ulcerated, that's not something to dismiss. It could be a sign of vascular changes, clotting issues, or another underlying health condition. So while most cases are harmless, it's worth knowing what's normal for your mouth, so you can spot when something's wrong. If your tongue seems too big for your mouth, pressing against your teeth, leaving indentations, or even making speech feel different, that's something you should pay attention to. An unusually large tongue is called macroglossia, and while it can be genetic, it's often clue pointing to something happening elsewhere in the body. For example, hypothyroidism, where a sluggish thyroid slows down your metabolism, can make tissues all over the body, including your tongue, swell. Another cause is acromegaly, a condition where too much growth hormone thickens bones and soft tissues over time. And in rare cases, amyloidosis, a disorder when abnormal proteins build up in organs, can cause the tongue to enlarge and stiffen. But it's not just about appearance. A larger tongue can affect breathing at night, contribute to sleep apnea, cause speech changes, or make chewing difficult. And one interesting study found that tongue size is actually one of the anatomical risk factors for obstructive sleep apnea, meaning your airway literally has less room. So if you noticed your tongue size changing, especially along with swelling in your hands or feet, changes in facial structure, or persistent fatigue, this is one of those moments where you don't just shrug it off, you get it checked. Because your tongue might be giving you the first clue to a much bigger problem. Your tongue isn't just a muscle, it's a living color chart for your health. Let's start with yellow. Sometimes it's just from bacteria or staining foods, but other times it's from jaundice, when excess bilirubin, a pigment made during the breakdown of red blood cells, builds up in the body. That can mean liver or gallbladder issues. A purple or bluish tongue can mean low oxygen in your blood, poor circulation, or even heart or lung problems. And here's the scary part. In one medical review, a bluish or purplish tongue was found in certain patients just days before they had serious cardiac events. Your body tries to tell you something's wrong with blood flow, but you have to know to listen. It's important not to panic, because sometimes temporary color changes come from harmless things like eating blueberries or candy. But if your tongue's unusual color sticks around for more than 2 weeks, especially with symptoms like shortness of breath, chest pain, or swelling, that's when it's time to call your doctor. Bottom line, the color of your tongue can tell you far more than you think, and ignoring those changes can mean missing an early warning your body is giving you. We've covered a lot of tongue signs today, but I saved this one until now because it's the single most important and potentially life-saving clue your tongue can give you. If you have a sore, ulcer, lump, or a rough patch on your tongue that hasn't healed in 2 weeks or more, do not ignore it. Most sores heal quickly, but when they don't, it can be a warning sign of oral cancer. And here's the frightening part. According to the Oral Cancer Foundation, early-stage oral cancer is painless in over 70% of cases. That means you could have a growing problem without feeling it at all. Catching it early massively improves the chances of successful treatment, but waiting even a few months can make a huge difference in outcome. This is why you absolutely need to know how to check your own tongue properly so you don't miss anything serious. And here's how to do it. Go to a mirror in bright light. Stick your tongue out. Check the top, the sides, and very important, lift it up to look underneath. You're looking for any sores, lumps, or rough spots, color changes, unusual coatings, or textures. If you see something that's not gone in 2 weeks, especially a lump or sore, book an appointment with your dentist immediately. I've actually made a separate video about the 9 warning signs of tongue cancer you should never ignore. Go watch it right now. Because when it comes to tongue cancer, early detection can save your life. Click it right here.